Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss 2025 CPC exam digestive system important questions. So far I have covered many concepts where you can easily score marks. That is HCPCS important questions I have already covered, coding guidelines I have covered, billing and compliance I have covered, also anatomy and terminology and ICD direct questions. Okay, and from chapter wise anesthesia and integumentary, musculoskeletal, and respiratory and cardiovascular. These many things I have covered, which are very important for this current year exam. Okay, so if you haven't checked those questions, you can check the playlist as 2025 CPC exam preparation. So you will be able to get all the videos within the list, so you can explore all those. Okay, and if you are interested to join the class to get more confidence and uh, to get pass, okay, by learning all the important profi coding and outpatient coding, you can join my classes. Okay, and there are too many awareness that I have to give, but in video, maybe you are watching this video just for digestive system questions, so I don't want to discuss all those now. I'll post it later, but which is very important. Once I post, please check that awareness post and definitely do not make such mistakes in your career. So yes, let's begin. First question. Patient is seen at doctor office for nausea, vomiting, and sharp lower abdominal pain. CT scan of abdomen is ordered. Labs come back indicating increased WBC count. Review of the CT reveals that acute appendicitis with perforation. The physician performs laparoscopic surgical appendectomy through an umbilical incision. So here the approach is very important. They are doing appendectomy procedure using laparoscopy. Okay, so let's find the answer. So before that, I will also give you what are the important concept you should go through. Apart from these questions, just a minute, please. Digestive system. So from index, I will tell you what are the very important profi coding. So as I mentioned earlier, CPC is for certified professional coder. Okay, so we will be getting questions more into professional coding. Okay, profi coding. That means office visit and outpatient visit. Okay, so in that you can check from digestive system. The important concepts are mainly scopy concept. Okay, it could be colonoscopy and EGD or endoscopy, esophagoscopy, esophagogastroduodenoscopy. Okay, you just have to check what is the scopy type. Okay, whether it is a rigid scope or flexible scope, and also all the scopy will utilize techniques as hot biopsy technique and snare technique. Okay, so you have to familiar with the techniques also, and also what kind of scopy they are utilizing to find the abnormalities. So here, so from liver, check for liver incision and excision also. Okay, biopsy, liver biopsy is very important. And then from colon and rectum, you have to be aware of colonoscopy concept, and the decision tree is very important for coding guideline. And then appendix is very important. Here you should be aware that appendectomy incidental and appendectomy with major procedure, appendectomy using laparoscopy method. Okay, all those are very important. And next, so here stomach and also hernia repair. Okay, hernia repair is very important. And also hemorrhoidectomy. Hemorrhoidectomy is also important, and hernia repair is important. Okay, so then cholecystectomy is important. So few things like I do have some around 36 definite question, right? In that, all these are concepts that keep repeating. So I am just stressing those. So you can go through all those concepts. So for this question, answer is, so as I mentioned, laparoscopic surgical appendectomy. So let's see. So appendix, incision and drainage of appendiceal abscess, 44900. Next, excision. So these three is for excision, okay, and other than laparoscopy method. And here using laparoscopy, 44970, laparoscopy surgical appendectomy. Okay, so in our question they are talking about laparoscopy approach. So the CPT should be 44970. And these three codes have their own concept based guidelines. So please go through. In the classes I'll explain each of these code thoroughly, but here it takes so much time, so I'm not going to discuss that. So the answer should be 44970. So option D is correct, 44970. And K35.32 you can check. So acute appendicitis with perforation. So this option D is correct. Okay. And also, just a minute. Yeah, I have shared the screen. Sometime I'll forget to share the screen, or sometime I will forget to unmute. So it will take so much time, then I'll regret. That's why I'll recheck. So option D is correct. And if you see here on option C, with acute appendicitis, they have also given symptoms. Okay, if you check those symptoms, which are integral, integral component, we say integral symptoms of the particular medical condition. Okay, so we don't have to code these symptoms along with the definite medical condition. So next question, a colonoscopy is performed. 3 polyps are removed from the ascending colon by snare technique. Okay, so colonoscopy they are utilizing, and using snare technique they are removing the polyp. Okay, snare technique they have utilized, and also with epinephrine injection. So they have also injected, and in the transverse colon, a small polyp is ablated with hot biopsy forceps. So two techniques are utilized to remove the polyp. Okay, and also injection also they have performed. So if you check the, there are 3 procedure here. So let's see, I'll show the codes. So please, you can pause the screen and you can pause the video, and please, you can take your time and you can navigate the answer. Okay, I am clear with the answer, so I'm just discussing a right answer. I'm not going to discuss the wrong options. You just have to explore, you have to navigate from the book. Colonoscopy is here. So using colonoscopy, they are using injection, they are injecting also, and they are removing polyp using hot biopsy forceps, and also they have removed polyp using snare technique also. Okay, 3 procedure they did. So how to code these procedure? You can check from here. So options, the correct option should be, just a minute, option B, 45385, 384 and 45381. So 45385 is snare technique, 384 is hot biopsy forceps, 45381 is for injection. Okay. So since these two are techniques, we are utilizing 59 modifier to distinguish between two same procedure, but the different techniques. Okay, removal of polyp only, that is the same procedure, but how they are removing is different. Okay, one is using snare technique and one is using hot biopsy forceps technique. That's why you should use 59 modifier to distinguish between those two procedures. Next, for 45381, this is for injection. Okay, this is again a different procedure. That's why you can utilize 51 modifier since it's a multiple procedures are there. Okay, option B is correct. Next one, a 35-year-old with sorry, I'm unable to pronounce it. So cholecystectomy with cystic duct artery are clipped and guided transhepatic cholangiography is performed. Poliolithiasis. Sometimes, no, when we are in flow, some words easily we cannot pronounce it. I hope everyone can understand that. So what CPT codes are reported? So here they have performed cholecystectomy using cholangiography. So you can check the options. So this radiologic is the same code with the 26 modifier. You just have to explore digestive system codes. So let's see the code. So cholecystectomy is here. So they have also utilized laparoscopy. Okay. So 47562 laparoscopy surgical cholecystectomy. 47563 cholecystectomy with cholangiography. Okay, this is the correct answer, 47563. And you can see for intraoperative cholangiography, radiologic supervision and interpretation, C74300 and 301. So what they have performed here, they have performed, transhepatic. So the radiologic thing also question, we have a shortened question here because it's a student keywords, right? So we have to navigate and then we have to extract the question from the mock papers. So you can just check 74300. Correct answer is option C. These are all important questions. Next, patient with acute appendicitis undergoes laparoscopic appendectomy. So again, question is regarding laparoscopic appendectomy. You are clear that answer is 44970 for laparoscopic appendectomy. With that, you should also check for ICD acute appendicitis. So unspecified acute appendicitis is the correct answer. Option D is correct. Next, upper GA endoscopy with gastrotomy, tube placement and band ligation of esophageal varices. So GI endoscopy with gastrotomy procedure. So check the options. There are two procedures here. One is gastrotomy tube placement and ligation. So you can go to gastroduodenoscopy. Under that, check for those option codes. So here we have 43244, 235, 244, 235. So what is 43235? 43235 is esophagogastroduodenoscopy, flexible transoral diagnostic including collection of specimen by brushing or washing. So this is not correct. Next, we have 43244 with band ligation of esophageal gastric varices. So this is correct. Okay, 43244 is correct. Along with that, we have one more procedure, that is tube placement, gastrotomy tube placement. So 43244 and 43246 with direct placement of percutaneous gastrotomy tube. So you have to code these two codes, 43244 and 43246. So the correct answer is option C, 43244 and 43246. Next, patient requires tube placement during EGD. Attempt to place a PEG tube, fail, a small diaphragmatic hernia is noted, and the procedure is aborted. So procedure is terminated here. You can check the modifier. So for discontinued procedure, we will utilize 53 modifier. So just cross check between option B and option D. Option B, there is no ICD. What CPT and ICD codes are reported? Okay, so in option D, we have CPT, modifier, and ICD also. So let's check what are these ICDs. So here, what happened is complication. Okay, why complication? Since patient had a complication to tolerate to the procedure, they have terminated the procedure. Okay, if patient is not tolerating to the procedure, they cannot advance the procedure or they cannot continue the procedure. Okay, they have to stop. So here they have aborted the procedure. That is a complication because due to the complications. Next, a small diaphragmatic hernia is noted. This is also definitive diagnosis. Okay, so you can check, one is for complication and one is for diaphragmatic hernia unspecified. So correct answer is option D. Patient with a small bowel obstruction and blood loss to ileum undergoes laparoscopic enterectomy and intraoperative appendectomy. So both in same incision, okay, they are performing two procedure using laparoscopy. One is enterectomy and one is appendectomy. Okay, again both codes we have to code. So you already know laparoscopic appendectomy code is 44970. With that you have to check for laparoscopic enterectomy. Laparoscopic, so you can see here 44202 laparoscopy surgical enterectomy, resection of small intestine, single resection and anastomosis. 44202 is correct. Along with that, you should also code for intraoperative appendectomy by laparoscopy. So the correct answer should be option C, 44970 and 44202. Next, patient with jaundice undergoes liver biopsy using MRI guidance. Two core biopsies are identified. Okay, this question is like more into radiologic question. Okay, but since we have options from 4 series also, I am discussing here. So they have performed the liver biopsy, okay, using MRI guidance. So you have to check liver biopsy using ultrasound guidance, liver biopsy using fluoroscopy, CT, and MRI. Okay, because they can utilize whatever the guidance they need according to the procedure or the patient. So here they have utilized MRI guidance. Okay, so check for liver biopsy code. 47000 says biopsy of liver needle percutaneous. And also you can see the note for imaging guidance is performed. See, this is ultrasound guidance code. 77002 is for fluoro. No, for CT. 77012 is fluoroscopy, I think. 77021 is for, MRI. Okay. So you have to code 47000, and since they have utilized MRI guidance, you should also code 77021. So the correct answer is option B, 47000 and 77021. Okay. Yeah. So I think these are few repetitive questions. Okay. So if you want all the important mock paper with classes, please join my CPC exam preparation classes. Okay, so CPC exam preparation classes for 3000. Okay, in that you will get around 25 days of live class. Like it will be around 2 hours to 2.5 hour class. Okay, you will be able to learn all the concept, and also if you have already taken training and if you have lack of knowledge, or maybe you got some kind of some 6 month gap and you started forgetting all the coding guideline, and you can definitely consider classes. Okay, and many will text me, send me mock paper, I will pay the money. I clearly mentioned, if you are coming for only material, then no. Okay, so I have really good name with the AAPC, and I really can't just for making money. I cannot put all my hard work just like that. Okay, you come to the class, attend live classes, learn something, and then I'm only going to provide you all the important material which can make you pass. Okay, so without teaching anything, if I just give material and by practicing all the things, if you are getting pass, that will not really satisfy me, and I will not even post that kind of feedbacks. Okay, if you pass using material, no, that's not the thing. You should learn the concept, because somehow you can use using some shortcuts and using some material, you can really get pass. Okay, but medical coding industry, it takes so much domain knowledge to survive. Okay, initial 6 months to 1 year, you need a really good exposure from the basic fundamentals. If you lack basic fundamentals, you will really struggle to stay in the job. Okay, that's what my concern is. So yes, that's all guys for today. Thank you for watching, and please do subscribe to my channel. And I feel I have to do more videos, but I don't get any proper views also. So I think most of you will not even watch my videos. So I feel okay. Let me let me do whenever I get time. That kind of mindset I am having currently. Okay, that's all. I do have classes at 6. Thank you all. Thank you for watching.